Okay, go.
Okay, before I start, I just want to ask what time it is.
It is 9 o'clock.
Okay, 9 o'clock. Alright, so I'm going to get my MAR. Here I have MAR number 7. I'm going to get patient number 7. And I'm going to compare this with my doctor's orders over here. So I have William Hopkins. Date of birth is 1970. And there are no known allergies, and he's here for a left total knee replacement. Alright, so his medications, he has a Moxie 300 milligrams, PO twice daily for 10 days, and I'm going to add thickener due to dysphagia, given at 9 a.m. Then we have a Nitroderm patch, 0.3 milligrams per hour, applied topically once daily. We do that again at 9 a.m. And Otic drops with 2 drops in the left ear once daily at 9 a.m. That's good. And if you wanted to just take a look at that.
Okay.
Okay, so I'm going to come over here and get my medications. William Hopkins, date of birth 9/12/1970. Okay, no allergies. First one we're going to get is a Moxie. Alright, we'll get one of those. We're going to get a Nitroderm patch of 0.3 milligrams. Nitroderm 0.3 milligrams. Okay, one of those. Then we need Otic drops. So in here we have the Otic. Okay, out of stock. I have them here. Okay, so open the drawer. First one is a Moxie. So we have a Moxie for my order, which is 300 milligrams by mouth twice daily for 10 days, adding thickener for dysphagia. So here we have my Moxie. Its dose is 250 milligrams per 5 milliliters. I'll reconstitute with 10 milliliters of water. And its expiration date is 8/2024. So not expired. We're going to get the Nitroderm patch, and we have 0.3 milligrams per hour, 0.3 milligrams per hour right here. Expiration date is in 2020, so not expired. And then the last one right here is the Otic drops that we need to give. We're going to give the 2 drops in left ear, and Otic drops expire 12/2019, so not expired. And I'm going to sign off. And come over here to prepare my meds. Okay, first thing I do is hand hygiene. Okay. Okay. So the first thing I'm going to get ready is my Moxie. Right here. Before we get started, I'm just going to do my math. So I need 300 milligrams. So 300 over 500 over, and that's 3,000 divided by 500, so 6 milliliters. My dose will be 6 milliliters. That's given. My 10 milliliter syringe to get my water. 10 milliliters. Okay. Now, crack it some because it's stuck. There we go. Okay, we're going to pull back up 10 milliliters. A little bit. There we go. Alright, so we have 10. Okay. And then put that in here. Mix it up nice and good. Well, as good as it can. And again, this is going to be the 300 milligrams of a Moxie that we're going to give by mouth to our patient. Alright, so So there's the 6 milliliters, which is 300 milligrams. Okay, let me get rid of this. And get a little bit of thickener. Let that sit and it'll thicken up for us. And then we have the Otic drops ready to go. And the nitro patch I'm going to do actually at the bedside. So I'm going to take my pen so I can write my stuff on it. Let me do this before I go. So I got my MAR and my meds. Knock knock. Hi, my name is Jessica. I'm going to be your student nurse today. I'm here to do some morning medications. And how are you doing today?
I'm doing good.
Good. Give me one moment. Let me just get my hands clean for you. See them falling over. All right. Before we get started, can I just have you verify your name and date of birth for me?
William Hopkins, 9/12/1970.
Okay, great. Patient matches MAR and wristband. All right. All right. So, do you have any allergies?
No, I do not.
No allergies. Okay. And it looks like so you have dysphagia. So you have a little trouble swallowing.
Yes.
Okay. So before we start your meds, I'm gonna just put your bed all the way up in the high Fowler's position so that we can help with swallowing. Okay. Before we get started, can you swallow for me?
Swallowed.
Okay. Thank you. Looks like we're okay for. And so the first medicine I'm gonna give you is gonna be your Amoxi. It's 300 milligrams. And I'm gonna, you're gonna get this twice daily for 10 days, so this is your first dose today. I put some thickener in here so you'll be able to swallow it. Alright, so we're gonna take that. Here you go. Alright. And let me check to make sure there's no pocketing. Okay, looks good. Great. The next one we're gonna do is your eardrops. You're gonna get 2 eardrops in your left ear. You're supposed to get this once every day, or once daily, and I got your drops here. Let me get these on. Okay, so I got them. Okay, so this is, again, Otic drops, 2 drops in left ear. So this is your left ear, so I'm going to have you turn to the right. Okay. I don't note any cerumen, anything in his ears. So we're going to pull upward. Here, yes. Pull upward and out to open up the ear canal. And I'm going to do 1 drop, 2 drops. Then we're going to massage the tragus. Okay, thank you. And then we're going to move on to our last medication for you. It's your nitro patch, your nitroderm patch. The dosage on this is 0.3 milligrams per hour. And I'm gonna add it to your chest. Before I get started with that, let me just look and make sure you don't have any. No other patches are noted. So I'm just gonna wipe this off so we have a nice clean spot to put it on. Okay? Okay. So I'm gonna open up the patch. And I'm going to put my initials, today's date, 10/9, at 9 a.m. Okay. And then, again, we have the 0.3 milligrams per hour. We're going to apply it topically. So, I'm going to get one of these edges off. There we go. Place it here. And there was no abnormal hair on chest, or lesions, or rashes. Alright, so we got your nitro patch on. I'm just going to pull up your gown for you. Alright. Now, are you comfortable the way you are? are?
Yes, I am.
You're comfortable. Okay. Is there anything else you need from me?
No, I do not.
No? Okay, well, I will leave your belongings here so you can reach them if you need. Your bed is in a lock-low position and your side rails are up. And if you do need anything, here's your call right here. You just push this button. Can you show me how to do that?
Click.
You sure? Good. Okay, thank you. You push the button for me, and then... Sounds good. Thank you for being here. I'm going to go ahead and document the medications I gave you real quick. So I gave you all 3 of your morning medications. Okay. Alright, I'm going to hand hygiene on my way out. And then I will take my tray and my Mar and be on my way. Thank you. Have a good day.